Careers and Jobs in the USA. Number 9. Physical Therapist Assistants and Aides. Learn about careers and jobs in the United States of America and improve your American English with Maestro Sersea. What Physical Therapist Assistants and Aides Do, Part 1. Physical Therapist Assistants, sometimes called PTAs, and Physical Therapist Aides work under the direction and supervision of physical therapists. They help patients who are recovering from injuries and illnesses to regain movement and manage pain. Physical therapist assistants are involved in the direct care of patients. Physical therapist aides often have tasks that are indirectly related to patient care, such as cleaning and setting up the treatment area, moving patients, and doing clerical duties. What Physical Therapist Assistants and Aides Do, Part 2. Physical therapist assistants typically do the following: observe patients before, during, and after therapy, noting the patient's status and reporting it to a physical therapist. Help patients do specific exercises as part of the plan of care. Treat patients using a variety of techniques such as massage and stretching. Use devices and equipment such as walkers to help patients. Educate patients and family members about what to do after treatment. Under the direction and supervision of physical therapists, physical therapist assistants treat patients through exercise, massage, gait and balance training, and other therapeutic interventions. They record patients' progress and report the results of each treatment to the physical therapist. Physical therapist aides typically do the following: clean treatment areas and set up therapy equipment. Wash linens. Help patients move to or from a therapy area. Do clerical tasks, such as answering phones and scheduling patients. Physical therapist aides are supervised by physical therapists or physical therapist assistants. The tasks that physical therapist aides are allowed to do vary by state. They usually are responsible for keeping the treatment area clean and organized, preparing for each patient's therapy, and helping patients as needed in moving to or from a treatment area. In addition, aides do a variety of clerical tasks, such as ordering supplies, scheduling treatment sessions, and completing insurance forms. Physical therapist assistants and aides, work environment and work schedules. Physical therapist aides held about 50,600 jobs in 2019. The largest employers of physical therapist aides were as follows: offices of physical, occupational, and speech therapists and audiologists, 60%. Hospitals, state, local, and private, 22%. Offices of physicians, 7%. Nursing care facilities, skilled nursing facilities, 4%. Government, 2%. Physical therapist assistants held about 98,700 jobs in 2019. The largest employers of physical therapist assistants were as follows: offices of physical, occupational, and speech therapists and audiologists, 46%. Hospitals, state, local, and private, 23%. Nursing care facilities, skilled nursing facilities, 10%. Home health care services, 9%. Offices of physicians, 5%. Physical therapist assistants and aides are frequently on their feet and moving as they set up equipment and help and treat patients. Because they must often lift and move patients, they are vulnerable to back injuries. Assistants and aides can limit these risks by using proper techniques when they work with patients. Work schedules. Most physical therapist assistants and aides work full-time, although part-time work is common. Some work nights and weekends because many physical therapy offices and clinics have extended hours to accommodate patients' schedules. Physical therapist assistants and aides. How to become one. Part 1. Physical therapist assistants entering the occupation typically need an associate's degree from an accredited program and a license or certification. Physical therapist aides usually need a high school diploma or equivalent and on-the-job training. Education and training. All states require physical therapist assistants to have an associate's degree from a program accredited by the Commission on Accreditation in Physical Therapy Education. Programs typically last about 2 years and include coursework in subjects such as anatomy, physiology, and kinesiology. Assistants also gain hands-on experience during supervised clinical work. Physical therapist aides typically need a high school diploma or equivalent. They also usually need on-the-job training that can last from about 1 week to 1 month. Physical therapist assistants and aides. How to become one. Part 2. Important qualities. Compassion. Physical therapist assistants and aides should enjoy helping people. They work with people who are in pain and must have empathy to help their patients. Detail-oriented. Physical therapist assistants and aides should be organized, keep accurate records, and follow written and verbal instructions carefully to ensure quality care. Dexterity. Physical therapist assistants should be comfortable using their hands to provide manual therapy and therapeutic exercises. Aides should also be comfortable working with their hands to set up equipment and prepare treatment areas. Interpersonal skills. Physical therapist assistants and aides spend much of their time interacting with patients, their families, and other healthcare practitioners. Therefore, they should be courteous and friendly. Physical stamina. Physical therapist assistants and aides are frequently on their feet and moving as they work with their patients. They must often kneel, stoop, bend, and stand for long periods. Physical therapist assistants and aides. Licenses, certifications, and registrations. All states require physical therapist assistants to be licensed or certified. Licensure typically requires graduation from an accredited physical therapist assistant program and passing the National Physical Therapy Exam for physical therapist assistants. The exam is administered by the Federation of State Boards of Physical Therapy. Some states require that applicants pass an exam on the state's laws regulating the practice of physical therapy assistants, undergo a criminal background check, and be at least 18 years old. Physical therapist assistants also may need to take continuing education courses to keep their license. Check with your state board for specific licensing requirements. Additionally, physical therapy assistants may earn certifications in cardiopulmonary resuscitation, CPR, basic life support, BLS, or other first aid skills. States do not require physical therapist aides to be licensed. Physical therapist assistants and aides. Pay. The median annual wage for physical therapist aides was $28,450 in May 2020. The median wage is the wage at which half the workers in an occupation earn more than that amount and half earned less. The lowest 10% earned less than $20,500, and the highest 10% earned more than $40,580. The median annual wage for physical therapist assistants was $59,770 in May 2020. The lowest 10% earned less than $33,840, and the highest 10% earned more than $82,470. Most physical therapist assistants and aides work full-time, although part-time work is common. Some work nights and weekends because many physical therapy offices and clinics have extended hours to accommodate patients' schedules. In May 2020, the median annual wages for physical therapist aides in the top industries in which they worked were as follows. Nursing care facilities, skilled nursing facilities, $34,800. Hospitals, state, local, and private, $30,620. Offices of physicians, $29,760. Government, $28,360. Offices of physical, occupational, and speech therapists and audiologists, $27,080. In May 2020, the median annual wages for physical therapist assistants in the top industries in which they work were as follows. Nursing care facilities, skilled nursing facilities, $67,120. Home health care services, $64,700. Hospitals, state, local, and private, $58,460. Offices of physical, occupational, and speech therapists and audiologists, $58,050. Offices of physicians, $56,730. Physical therapist assistants and aides, job outlook. Employment of physical therapist assistants is projected to grow 33% from 2019 to 2029, much faster than the average for all occupations. Employment of physical therapist aides is projected to grow 21% from 2019 to 2029, much faster than the average for all occupations. Demand for physical therapy is expected to increase in response to the health needs of an aging population, particularly the large baby boom generation. This growth is staying more active later in life than previous generations did. However, many baby boomers also are entering the prime age for heart attacks, strokes, and mobility-related injuries, increasing the demand for physical therapy needed for rehabilitation. In addition, more physical therapist assistants and aides will be needed to help patients maintain their mobility and manage the effects of chronic conditions such as diabetes and obesity. Moreover, medical and technological developments should permit an increased number of trauma victims and newborns with birth defects to survive, creating added demand for therapy and rehabilitative services. Physical therapists are expected to rely on physical therapist assistants, particularly in long-term care environments, in order to reduce the cost of physical therapy services. After the physical therapist has evaluated a patient and designed a plan of care, the assistant provides many parts of the treatment as directed by the therapist. Job prospects. About 15,100 openings for physical therapist assistants and 6,900 openings for physical therapist aides are projected each year on average over the decade. Many of those openings are expected to result from the need to replace workers who transfer to different occupations or exit the labor force, such as to retire. Job opportunities should be good in settings where the aging population is most often treated, such as skilled nursing homes, home health, and outpatient orthopedic facilities. Physical therapist aides with an associate's or bachelor's degree may have better prospects than will those without one, as some employers prefer to hire candidates who have a degree. Physical therapist assistants and aides. Summary. 2020 median pay, $49,970 per year, or $24.02 per hour. Number of jobs 2019, 149,300. Job outlook 2019-2029, 29%, much faster than average. Employment change 2019-2029, 43,000. Citation: Bureau of Labor Statistics, U.S. Department of Labor, Occupational Handbook, Outlook Handbook, Physical Therapist Assistance and Aids at www.bls.gov, OOH, Healthcare Physical Therapist Assistance and Aids. Visited April 16, 2021.